what do the numbers mean on the ECG printout? So these numbers are quite useful, providing you use them alongside your actual ECG assessment, because they can help you calculate things like the PR, QRS and QT interval, as well as the heart rate. Some machines might display this information slightly differently. With the equipment I have access to, it looks like this. HR stands for heart rate. This tells me the heart rate is beating at 58 beats per minute. Most texts I've read class a normal heart rate as between 60 to 100 beats per minute, so according to this metric, this is slightly below normal. The rest of these numbers are given in milliseconds. Now, this may be in seconds on your machine, so just make sure you double check and look for the unit of measurement. The overall P duration refers to how wide the P wave is. For this to be considered normal, it needs to be less than 120 milliseconds. So by looking at this calculation, I can see there's an abnormally wide P wave. This can mean there's evidence of left atrial enlargement, especially when there's an extra notch in the top of the wave like there seems to be here. The overall PR interval refers to the distance between the start of the P wave and the start of the QRS complex. This is classed as normal if it's between 120 to 200 milliseconds. So looking at this, I can see that the PR interval is slightly prolonged, prompting me to assess this interval more closely to look for a likely cause. The QRS duration refers to the width of the QRS complex. A normal QRS width can vary slightly depending on textbook, but I usually like to ensure it's between 60 to 120 milliseconds, because a complete bundle branch block requires a QRS complex of over 120 milliseconds, and this is one of the most common causes of a prolonged QRS duration I come across in practice. The overall QT interval describes the distance from the start of the QRS complex to the end of the T wave. Again, normal durations vary slightly depending on textbook, but anything between 350 to 460 milliseconds in women and 350 to 440 milliseconds in men is generally considered normal, with a duration over 500 milliseconds seen as extremely prolonged and at a high risk of developing life-threatening arrhythmias such as torsades de pointes. To make life more confusing, the overall QT interval is only accurate if the rate's beating at 60 beats per minute. A fast or slow heart rate can cause this to be inaccurate. For this reason, some machines have a QT corrected calculation, which adjusts for the change in rate and provides an accurate reading. But as you can see, I don't appear to have that luxury. So one way around this is to get the calculator out and give the Hodges formula a go. This isn't the only formula, it's just the one I find easiest. So in this example, we'd do 58 minus 60, giving us minus 2. Minus 2 times 1.75, giving us minus 3.5. And then add minus 3.5 to 398, which is the QT interval. And this gives us 394.5, the QT corrected. You can also use this site, which gives you the same result and is a little bit easier.